Hello and welcome everyone. Today we'll be discussing the journal that is intubating conditions during rapid sequence intubation with rocuronium and succinylcholine in elderly patients. This is a RCT which was published in the Scandinavian Journal. RSI or the rapid sequence induction is used to protect the lungs in patient at risk of aspiration during general anesthesia. RSI typically involves hypnotics and neuromuscular blocking agents, which are fast onset of action. Suxamethonium with an onset of action of 60 seconds is commonly used but has a significant side effects like cardiac arrhythmia, hyperkalemia, muscle soreness, short duration of action. Rocuronium with an onset of action of around 65 seconds is an alternative. Longer clinical duration of 80 minutes at zero point 0.9 milligram per kg is the problem, and the side effects are fewer compared to succinylcholine if we look in terms of the electrolyte imbalance and the muscle soreness. So the rationale of the study is that number of elderlies undergoing anesthesia is increasing. Age-related changes affect the NBA pharmacokinetics, potentially influencing the intubating conditions. Prior studies suggest that rocuronium with 1 milligram per kg provide excellent intubating conditions in 93% of the adults versus 76% with succinylcholine. Now, a systematic review found no significant difference between the two drugs. No systemic data exists for patient group which is more than 80 years. So the aim of the particular study was to compare the intubating conditions between rocuronium and succinylcholine in patients aged 80 years and above. Now, the hypothesis here was that rocuronium provides a higher proportion of excellent tracheal intubation condition compared to suxamethonium in this group of patients. The study design was approved by the ethics committee. It was registered and conducted in accordance with the various guidelines. It was mainly conducted in 4 Danish anesthesia departments. The inclusion criteria were age more than 80 years, ASA physical status 1 to 4, scheduled for surgery under general anesthesia with RSI indication, and body mass index less than 35. Now, the exclusions being neuromuscular disease, allergy to rocuronium or suxamethonium, hyperkalemia, malignant hyperthermia, butyrylcholinesterase gene mutation, and EGFR less than 30. The randomization was conducted on the day of the surgery using a computer generated algorithm in the red cap. Patients allocated to the rocuronium or succinylcholine were given. Blinding was done. Study medications was prepared with identical volume and labeled as study drug. Anesthesia of the nurse anesthetists were blinded to the drug allocation. Patient were blinded until 3 days follow-up. Surgical personnel were blinded to the drug allocation. Pre-oxygenation was done, that is the anesthesia protocol, done for 3 minutes with FiO2 of 1, and induction was done with alfentanil, propofol, rocuronium or succinylcholine. Intubation was performed 60 seconds after the injection. Video laryngoscope was used. Tube size was 7 for women, 8 for men. Intubation was performed by trained anesthetist or nurse anesthetist. The post-intubation care, that is mechanical ventilation, was initiated for normocapnia. Core temperature was maintained more than 35 for forced with the air warming. Regarding the neuromuscular monitoring, the electrodes were placed in the ulnar nerve and the train of 4 was measured every 15 seconds. Arm was fixed to avoid the muscle movement artifacts. Monitoring was continued until the train of 4 was more than zero point 0.9 for extubation. Neuromuscular recovery reached plateau at least 2 minutes. Recalibration was done after some time. Regarding the follow-up and outcome measures, 24-hour follow-up was given. The patients rated the hoarseness, sore throat and muscle soreness on a scale of 0 to 10. 72-hour follow-up evaluated the cause of complaints. The adverse events monitoring was done for ECG changes, injection site edema, residual muscle weakness, double vision, bronchospasms. The primary and secondary outcomes. The primary outcome was proportion of patients with excellent intubating conditions at 60 seconds, which was scored by the Fox-Buder scale. And the secondary outcome were time to tracheal intubation, first pass success rate, onset of time, that is TOF 0, intubating conditions by intubation difficulty score, occurrence of desaturation, new cardiac arrhythmias, dental injury, post-op symptoms, that is muscle soreness, hoarseness, and sore throat. Statistical tests used were t-test for parametric, Mann-Whitney for non-parametric, chi-square for proportions. Significance was p less than 0.05. Sample size calculation, expected 90% intubating conditions with rocuronium, 65 with succinylcholine, 45 patient per group at 80% R and 5% type 1 error. 110 patients were enrolled to ensure 90 were evaluated. So total 102 patients were assessed for eligibility, 90 were randomized, 49 and 41. And the 41 is the succinylcholine group, 49 is the rocuronium group. The outcomes was excellent intubating conditions were seen in 73% with rocuronium, 75% with succinylcholine. No significant difference between the two groups. Time to intubation 159 seconds with rocuronium, 154 with succinylcholine. No significant difference. First pass success was 98% in both groups. Regarding the secondary outcomes, the train of 4, 0, succinylcholine 99, rocuronium 131. Significant shorter succinylcholine in the succinylcholine group. Intubation difficulty score, median 0 in both group, no significant difference. Post-operative outcome, no difference between the group for desaturation. No new cardiac arrhythmias. Regarding the post-op symptoms, muscle soreness had no difference, hoarseness had no difference, sore throat had no difference. Adverse effects, aspiration 2 cases, 1 each group, dental injury 3, all in succinylcholine group. Adverse side effects, 8 total. Serious adverse effects, 8, 7 in rocuronium, 1 in succinylcholine. In the rocuronium group, they had 2 post-operative bleeding, 1 desaturation during mobilization, 2 readmissions, 1 impaired vision, 1 intraoperative cardiac arrhythmia. Succinylcholine group, there was just 1 post-operative muscle weakness. The total reported adverse effects were 28, 17 in the succinylcholine group. Notable findings were bronchospasm, 2 cases. ECG changes 1, which was in rocuronium group, IV site edema 3, 2 in succinylcholine group, double vision 3, 2 in rocuronium group, post-operative muscle weakness, succinylcholine 12, and in rocuronium group it was 7. The limitations is that it is no universal standardized method for assessing the intubating conditions. The use of video laryngoscope instead of the direct laryngoscope may have influenced the results. A different competence level among the intubating clinicians could be there. So to conclude, no significant difference in intubating conditions between rocuronium and succinylcholine in patients more than 80 years. No major difference in post-operative complications. Succinylcholine had faster onset but did not improve the intubating conditions. Careful monitoring of the neurovascular blockade is necessary in elderly group. Thank you for your patience.